Hello, my name is Sue Wilkinson and I'm extremely proud to say that I'm the Executive Chief Nurse for West Suffolk NHS Foundation Trust. I've been a nurse for more than 30 years. The majority of my career has been spent within surgical areas and specialties across a tertiary acute trust, multi-site district general hospital and more currently an integrated acute community trust. During the early part of my career, I focused on raising my children and worked part-time hours to suit the family with no clear career pathway. This involved a lot of night duty and weekend work, which, although not terribly sociable, enabled me to experience a level of autonomy and leadership that might otherwise not have been available. I used my spare daylight hours to build on my education and development, gaining a clinically based diploma and BSc to support my career progression to a clinical nurse specialist role in colorectal surgery. It was while leading a team of specialist nurses across surgery that I was offered the opportunity of a head of nursing post, during which time I undertook an MSc in healthcare management and leadership. While in this post, I realised my love of leadership and understood what an impact on patient care and experience and outcomes one could have in a leadership role. However, I recognised that in order to further develop myself as a leader, I needed to seek opportunities away from academia and move towards experiential approaches that were flexible and met personal and organisational goals. Undertaking the NHS Aspiring Leaders programme provided a start on my journey of self-exploration and development and supported my transition into a Deputy Chief Nurse role. It was during this time that I was fortunate enough to work with a Florence scholar who absolutely extolled the benefits of the Florence Leadership Programme and encouraged me to apply for the scholarship. Why Florence, you might ask? Well, it identified benefits to me, with focus on leadership style, impact of self, confidence, change, self-reliance, and a really personal approach to leadership that it resonated with me and my approach. Finally, during my Senior Leaders Scholarship, I've been fortunate enough to secure an Executive Chief Nurse post, not without its challenges midway through a global pandemic. Before undertaking this programme, I most definitely would not have had the confidence to even think of applying. My experience of the Florence Scholarship. It's all about feelings and how they impact on individuals, and I wanted to describe my own personal Florence experience and development opportunities through the use of feelings. Throughout my scholarship, I have learned and understood the impact and importance of using feelings to describe and assess various successes and areas for improvement. So, how did I feel? Now, at the outset, during and now. I was nervous. Gosh, very nervous. I had huge imposter syndrome. What was going to be expected of me? How would I match up to others? Would I be out of my depth? How would I balance the need to focus on self whilst also focusing on those around me? I needn't have worried. My peer group have been such a source of support, guidance, and honest feedback and learning. I was excited in equal measures as nervousness. This offer was a unique opportunity. It offered unique experiences, RADA, House of Lords, networking with fellow and existing scholars, and a bespoke leadership programme with personal opportunities. I was grateful. Gosh, I was so grateful. This was something completely new to me and unknown, and a chance to really maximise my own learning potential and explore my personal impact on others around me. I was optimistic, really hopeful in adding to my toolkit in leadership and improving my capabilities, confidence, personal and professional impact, enabling positive and empowering team working and staff engagement. Standout moments. There were so many. Meeting my fellow senior leaders and building relationships. RADA. Although due to date clashes I had to undertake this with another group, which I was sad about, however was made to feel very welcome. And these few days really did push me out of my comfort zone and encouraged me to channel my inner calm and presence. However, the real standout moment for me was my choice of leadership course. I reviewed all the opportunities available and discussed my learning outcomes with my mentor and focused on a programme that would match both my personal and professional goals. I chose and undertook the 5-day residential programme with the Leadership Trust. Oh my word, this was something else. The programme was full on, long days, evening work and physical challenges. The whole approach focused on true real-time feedback from peers within my allocated team, Team Red, who you can see here. Through the use of feelings, impact and reflection, we discussed all our interactions. It totally pushed me out of my comfort zone on so many levels, enabled me to really understand how I made others feel and how they made me feel, and how I managed that physically and emotionally. It was the first course I have undertaken outside of a healthcare setting or higher education institute. I learnt how to overcome my anxieties and misgivings about a given situation. I'm a helper and gain my strength by being able to support others to achieve. For example, we went caving. Gosh, I was so nervous. However, I realised that I was able to park my anxieties and nerves and concerns to help others and support them to succeed. This gave me a positive focus to channel my nervous energy and feeling of true accomplishment. I learned how my approach, opinions, thoughts impacted on others and guided me to increasing my ability to influence whilst being compassionate, authentic, and an honest leader. I developed my ability on how to receive feedback, after all it is a gift, in an open and positive way. There was a fantastic facilitation across the group and I felt valued and safe at all times. My improvement project. I've always been passionate about advancing roles and innovative workforce models to meet ever-changing care delivery models. I'm a true advocate of developing evolving practice and supporting all to work to their full potential. With the experience and insight this opportunity has afforded me, I was able to bring my improvement project to life and really use my newfound skill set to progress work on leading, influencing and developing innovative multidisciplinary workforce model across both the acute and trust and system-wide. My improvement project was to set up and lead the development of a system-wide advancing roles group, which was to provide oversight and a strategic vision for workforce development, training and governance in a consistent way to ensure patient and staff safety, quality of care and effectiveness. The membership of this group was wide and included all key stakeholders, clinicians, advanced practitioners, allied health professionals, higher education institutes, Health Education England, workforce leads, finance leads and nursing representatives. During the rollout of the project, we visited a number of other organisations to see what a mature model would look like and how we could learn from their journeys. We shared documents and experiences through virtual and face-to-face visits. We continually monitored regional and national workforce initiatives and maximised all opportunities for funding and expert advice. To support the delivery of the project, I was able to deliver a compelling business case for and to successfully recruit a lead role for advancing practice within my trust, in addition to a number of trainee posts. This resulted in a system-wide framework, workforce plan and governance structure to support the training and integration of these roles across the trust and the wider system. It's vitally important to the future healthcare systems that we build a workforce that is recognised, responsive and creative in responding to increasing healthcare challenges. We should feel empowered to evolve better ways to achieving quality and provide care with the right skills in the right place at the right time. The impact of this project enabled us to meet the ever-changing needs of our patients, service users and stakeholders through innovative new workforce models. It has also provided a professional development framework for healthcare professionals wishing to progress themselves into the advancing practice and leadership roles. Unfortunately, due to the onset of the pandemic, we have been unable to fully evaluate qualitative patient or staff experience data as yet, but we will be exploring how to evaluate and capture this information going forward. Finally, thank you. Thank you to my sponsors. Thank you to Lisa Bayliss Pratt and the Eastern North Hertfordshire NHS Trust. Without this opportunity, I truly do not think I would have developed into the leader that I am and have the confidence to apply for my current role. I feel extremely privileged to have been given this opportunity and definitely feel that I have utilised all my experience and learning over the past year through the pandemic, and my, what a year we have had. I reflect daily on all that I've learned and experienced, and I've shared the approach with my executive team and fellow board members and sell these opportunities to anyone. This has been fantastic. Thank you.